Hey everybody, Dr. Brad Bodel, and today I wanted to spend a little bit of time kind of fleshing out the differences between paleo diets and ketogenic diets. Now, a lot of times I'll have patients come in to me and they'll say things like, the paleo diet was really great for me. I felt a whole lot better when I started it, but I noticed that I either didn't lose weight like I thought I was going to, or I actually gained weight. Well, this is a little confusing for people because you'd think if I'm choosing to eat a whole bunch of nutritious and really healthy foods, why would we see an increase in weight, especially if we're feeling better? Well, here's the reason why. When we talk about paleo diets, the key is that a paleo diet is focusing on what we are eating. And what can commonly happen here is we tend to take out a lot of the foods that are inflammatory to us. And in doing so, we can feel a whole lot better. So if you are someone who is sensitive to things like grains or dairy or nuts and seeds or nightshade vegetables or corn and soy, you'll see different variances of the paleo diet and what's allowed and what isn't allowed. You will tend to notice a big improvement when you take these things out of your diet. So you're managing that inflammatory response that you were having to those particular foods. However, the key distinction between paleo diet and ketogenic diet is although we're focusing on what foods we're eating, we're not focusing on how much. So we can actually get into a bit of trouble in terms of over-consuming foods that may not be very helpful in terms of managing our weight appropriately. So if you're someone who has gone on a paleo diet and you notice you feel a lot better, keep that in mind. Keep that in your back pocket because there's still some really positive benefits for you. The issue is that we now need to go one step further and say, okay, how can we now manage our macronutrient and total caloric intake to be most effective for helping you lose weight if that is one of your goals? So the ketogenic diet is one that focuses in on just that. It's a diet that restricts our carbohydrates, increases blood ketone levels, and has different percent macros in terms of protein, fat, and carbohydrate that ideally will allow us to optimize things like our metabolism and help us to lose weight. So typically people who do well on paleo and then add in the ketogenic aspect of it will now have another sort of set point or jumping off point that allows them to track things in a more efficient manner. And that way they can then reflect on different things that they may be overeating, undereating, or whatever it might be. Usually in our day and age of kind of some of our more popular keto diets, people will tend to push things like high fat intake. But I find that in general, just a little tip for some of you guys out there who are trying this sort of approach, we can sometimes overdo it with our fat consumption. And that can also be something that stalls out our weight loss. So these diets aren't perfect, but if we understand the goal behind them, it can really help us to leverage these things to best serve our needs. So again, if you're someone who is suffering from inflammatory issues, gut sensitivity, autoimmune conditions, then it's really worth your time to look into something like a paleo diet, like a low immunogenic diet, to see if some of those foods are causing reactivity. On the other hand, if you're someone who's dealing with weight issues, blood sugar regulation issues, things like prediabetes, diabetes, and reactive hypoglycemia, then focusing in on a ketogenic diet may be more valuable for you. So when it's all said and done, it all comes down to what are your goals and what best fits your needs.